Let's start with take a look at our U.S. numbers. As you can see the graph, those numbers are coming down. The current 7-day moving average of daily new cases, 106,395, have decreased by 13.3% compared with the previous 7 days. And a total of 43,298,203 COVID cases have been reported as of September 29th. So you can see that we have 75.8% of the people 12 and above have at least one vaccination. And so we're slowly moving up that percentage, which is also very important if we're going to get this under control. Our number of vaccinations have been increasing. And you look at this number here is the total population, so not to be confused. We always look at the 12 and above because the 12 and below have not been able to be vaccinated yet. But you can see that there is a decline after our peak here of vaccinating, and it's going down a little bit, went up, and then come down. And it's very similar to what's going on here in Palm Beach County. So we have administered over 214.3 million people have been vaccinated and received at least one dose. About 184.6 million people, or 55.6% of the total population, have now been fully vaccinated. Now, there's one of the things I also want to cover today is the definition of the boosters and the third dose. I went over that at the last meeting, but I thought I'd put it here a little bit clearer so people can understand, because there's a lot of confusion. So the booster shots have been now approved by the FDA for Pfizer vaccine only. And for those people who've completed their initial series at least 6 months prior. So they can now get a booster. And that is for people who are 18 years of age, who live in long-term care settings, or have underlying medical conditions, and also for those who work in high-risk settings or live in high-risk settings. Now, what do I mean by high-risk settings? So that includes first responders, it includes healthcare workers, firefighters, police, and congregate care staff. It also includes all the education staff, including teachers, support staff, and daycare workers. It also includes food, agricultural, and manufacturing workers, correction workers, U.S. Postal Service workers, public transit workers, and even grocery store workers. So this is a large group of folks. All these people are in contact with the public in many settings. For those individuals are now allowed to get a booster shot. So you have to get the booster from Pfizer, and you have to get the same vaccine for that booster, and that should be 6 months apart from your last vaccine. The third dose is what originally was reserved for people who are severely immunocompromised, especially those who may not build the same level of immunity to the 2-dose vaccines compared to people who are not immunocompromised, who are building a normal immunity against it. So for those people, they should receive a third dose. And it's very important that if you go ask for the third dose of Moderna or Pfizer, that you make that statement, that you want a third dose. Because if you ask for a booster, you're not going to get it, okay? So that can be done 28 days after the second dose. And those are the people who are considered moderately to severely compromised are people who have had organ transplants, HIV or AIDS, are actively on chemotherapy, so for cancer, people who are actively taking it, not past, but actively taking chemotherapy, and also folks who are on immunosuppressant medications that decrease their immunity and therefore they make less antibodies in their body. So that's the thought, and it's very important to make that distinction, especially when you go to the pharmacies or to a testing center, that you ask for the right thing. Now, let's take a look at where we are in terms of our community transmission by states. All of the states, with the exception of California on the West Coast and Connecticut right there. You can't really see that very good on the slide, but Connecticut is in moderate, and so is California. Puerto Rico is actually down under substantial. That's where we were back in June. So we cannot be complacent, and we can't let our guard down. The CDC is still recommending the use of masks, even if you're vaccinated, because we are still in high community transmission. And most of this is because of the Delta. As you can see, the Delta has basically taken over all the variants. The predominant variant is the Delta in all our states, as well as here in Florida. This is a graph of where we've been in terms of cases per week. And you can see that, like I mentioned last time, that even though we have, our peak was much higher in terms of how many folks we had, that the cases per week was lower in January than it was now. So we're finally down to about where we were along here. So we're definitely seeing a very nice curve going down, and we hope that we can sustain that until at least the winter months. We'll see what happens again in a couple of months. So let's take a look at our Florida numbers then. So we see that we have now, we're at, remember that we're giving these dates, we're giving this data on every Friday. It gets released at around 5 o'clock in the afternoon. These are the numbers that we're allowed to release to the public. And these numbers are then going to the CDC. So our new positivity for the last weeks, the weeks of September 24th through September 30th, we were at 6.5, the same as it was for Florida. But our cases per 100,000, we started reporting that, and that is very important. And I'll show you the next slide why that is so important. That's down to 162.6 per 100,000 population. That went down over 34 points, 34.1 points. In terms of our cumulative data, we have seen a total of 963,627 people vaccinated in Palm Beach County. That accounts for 74% of the population over the age of 12 that can take the vaccine. Our number of cases total is 220,108, and our total positivity, which has not changed, that's good because it had been going up. So right now it is not changing. That number will not come down until our daily positivity goes down below 5. So we'll see that going down soon as this keeps going down. That number is 19.6, and that's good that it hasn't changed. At least it's not continuing to go up. So why am I talking about these two numbers right here? I'll show you the ones here for Florida, the daily positivity and the 100,000. So the way that the risk is determined is to look at the number of cases per 100,000 in the past 7 days, it's a 7-day average, and the daily positivity with the PCR test for the past 7 days. So if we take a look at these numbers, it shows you where it needs to be. So right now, our 100,000 is 162.6, which is above 100. But our daily positivity is 6.5. So that 6.5 would put us down here under moderate. So we have moderate for the positivity and high for the population. So if one is greater than the other, you take the highest one to determine your risk. So therefore, Palm Beach County is in high, and so are the rest of the counties except Glade County and Henry, who have moved to substantial. And remember that in June, at our lowest moment, we were in moderate, and we were very close to moving down to low. We had below the 5.5, the 5 positivity rate, but our 100,000, our cases per 100,000 did not reach below 10. So that's why we didn't quite make it to the blue. We were very, very close. So that's important because this metrics is being used in many places to make administrative decisions and to take a look at it. It's very important that you measure this for several weeks. You can't just take a one-day point in time. You should at least see it stabilizing for at least a minimum of 2 weeks. I prefer 4 to make sure because things can change rapidly. So that is something that can be used to make determinations in terms of what to do with, you know, the cities and the crowding and everything else that all of you have to make decisions upon every day. Our vaccinations are going well. I'd like more people to get vaccinated, but we are doing well. We're continuing to go up. So we're up to 74% of total vaccinations. Completed doses is only 64%, and 10% have only taken the first dose. Broward is at 84% and Miami at 91%. However, we may reach the substantial level faster than Broward and Dade because their cases per 100,000 is higher than ours, even though their positivity is much lower. So that'll be interesting. And you know, we're always in competition with other counties, so we want to get to substantial before they do. The monoclonal therapy has really dropped off. So far, the total number of sites, the 25 sites, have vaccinated over 124,071 individuals who have gotten monoclonal therapy. For West Palm Beach, we're at 5,813. And it's very interesting to see that on September 28th, our numbers were very low. We were down to 47 shots only that we gave. 47 people got monoclonal therapy. They've really gone down. Our peak was about the 3rd or 4th day that we were open. We did 1,300. But on September 29th, for some reason, all of our top 5 locations all increased. So that tells me that more people, for some reason, I don't know if the cases had gone up. Interestingly enough, when I looked at the positivity, the daily positivity at the CDC website, which they change more frequently than our report, the positivity had gone up a little bit. So I hope that's just a blip and not a trend going back up. So our main efforts are to continue our efforts since we have the Delta variant that continues to be the predominant variant that is much more contagious and causes breakthroughs. That's why we're having so many cases. Vaccinations remain the most important tool to stop the spread of saving lives. In addition to that, we have to wear our masks, wash our hands, good hygiene and distancing. All those things will stop us from getting the virus. Hospitalizations are decreased with more COVID cases being discharged than those that are being admitted. That's very important. As of 10/3, the unvaccinated patients remain the predominant admissions at 84%. There are fewer children being admitted at 3% of the 197 admissions that we had, and 5% of the children are in the ICU, but the numbers are much smaller. So we need to be prepared in case there's another surge coming in the winter and the holidays approaching. The viruses from the southern hemisphere will migrate to the north during the winter, as they always do, and so we have to be ready in case that happens and be prepared. So please continue to urge folks to get vaccinated to protect yourself, your family, and of course the community at large.